Hey guys, today I'm going to talk about diagnosing this particular deep bite case. So let's jump right in. So your patient come to you with this severe deep bite. You're looking at is the class 1 molar relationship. The buccal cusp of the upper first molar is articulate with the buccal grooves of the first mandibular molar. So that's class 1 molar. That's good. But the anterior is having the class 2 relationship. Canine is the reason because of something that we're gonna need to investigate. So you see how deep this case, like 100% overbite overjet, you can see. So let's just focus on the problem. The goal is we can see that there's no room for the canine to go in, so we need to eliminate first bicuspids to move them back, the canine back. See that if you remove this and this, your tooth here gonna go back here and everything gonna go back. That's gonna be improving the bottom tooth. There is no bicuspid, so we have to use this and this first bicuspid to make it like a canine. Okay, so we need to do that. Take a look at the deep bison problem. This patient have the deep curve of speed because of what? Because these tooth here are super erupted. So what we can do is just level them down. Make sure you got the wire, bend the wire, whatever it takes to move these down below this cuspid here. That's how you level the occlusal plane. That's how you reduce the deep bite. So it's not hard. You can do it. So you see this deep bite case? Once you understand the problem is, you can take care of your patient. Hoping that with this kind of orthodontist case, you can help your patient. I want to do is finish this case, and if you want to learn, subscribe to my channel and follow the membership program. We can get you where you want to be. Thank you.